Hi, my name is Stacey Pitts, and I'm the co-founder of CBD BioCare. And joining me is chiropractor Dr. Frank Michalski from Buffalo, New York, who is an expert on using CBD, but he also has been using CBD BioCare products for the past year and a half. So welcome.
Thank you for having me, Stacey. Glad to be here.
Well, Dr. Frank, we discussed a topic that we are going to dive into today, and that topic is inflammation, which really affects all of us. So we're going to talk about how to recognize it. We're going to talk about why it is important, and of course, how CBD may be able to help people. So let's start with identifying what is inflammation.
Of course, that's a great question. So we talk about inflammation all the time, right? And people don't really fully have an understanding of what inflammation is. So let's be clear. One of the topics that I really wanted to dive into today is chronic inflammatory disease. If you Google Time Magazine, you're going to see a while ago, they referred to chronic inflammatory disease and they called it the silent killer. The problem is a lot of people don't know that they have inflammation in their bodies. It's not something that you always feel. Now, if we're talking about acute inflammation, where someone stubs their toe or they get a splinter, of course, we feel that pain, we see heat, we see redness around the area. But what about chronic inflammation that builds up over time? So let's use that example of getting a splinter in your finger just to kind of define what inflammation is. So say I'm working on my patio and there's a piece of wood and I get a splinter in my finger. What happens is my body is going to recognize that there was an injury. Hormones and chemicals are going to be released underneath the skin and my blood vessels are going to dilate. That's going to allow for more blood flow to the area of injury. In that blood going to the area of injury, there's going to be histamine and bradykinin and all sorts of anti-inflammatory molecules that are going to go to that area and they're going to clean up that injury. So what I like to explain to people is at first, that's a really good thing. We want our body to heal. We want some of that initial inflammation in an injury like that because that's what kickstarts the healing process. I'm going to use the analogy. I heard this on a functional medicine seminar, and they use the analogy of inflammation like a furnace. Think of a furnace in your house. If it burns too hot, you're going to be sweating, you're going to be uncomfortable. If you live in Buffalo and it's winter and your furnace breaks, you're going to be freezing, right? You need that furnace to maintain a nice balance. Inflammation is the same thing. So let's go back to that example that I was giving with the splinter. Now imagine that process of the blood vessels dilating, all the chemicals rushing to the area, but picture that process never shutting off. Now, take it a step further and picture that happening everywhere in the human body. So in the gut, in the brain, in the joints, where inflammation has become out of control. That's really what inflammation is. So you're taking that acute inflammation, and I tell patients, imagine that on steroids. Imagine a furnace that can't turn off. It's burning too hot. And this is what Time Magazine dubbed the silent killer, chronic inflammatory disease. And as we'll be discussing, it's something we're all susceptible to. No one is not susceptible to this.
So what I'm hearing from you is there's really different levels of inflammation so that you can have that stubbed toe or that splinter that gives you that acute inflammation, but then you have that chronic inflammation where it can be isolated to an area of your body or it could be throughout your body, and it can stem from a number of things, right? Injury, it can stem from the food you're eating, all sorts of things. So let's talk about how people can identify the types of inflammation and if they're inflamed, because it's really obvious when we stub our toe that it's inflamed, it hurts, but how do we identify if we have inflammation throughout our body?
So when we're working with patients, there's a few ways to go about it. So we look at, in our offices, chronic inflammatory disease as kind of the diagnosis, right? So say someone comes in and they have diabetes, or they've had, they have neurodegenerative changes happening, Alzheimer's, Parkinson's, really at the root of those. And now you're seeing literature supporting this for different types of cancers too, even, is this chronic inflammatory disease. So what do these patients come in with? Usually there's insomnia. depression, anxiety, pain, and fatigue is a really big one. I would say that chronic fatigue syndrome, right, that so many people get diagnosed with, that depression that people get diagnosed with, we're always taking that a step farther and we're saying, okay, we have depression here, or we have chronic fatigue syndrome, or we have widespread pain in the body, or we have that patient who can't sleep for the life of them and they just can't figure out why. We're starting to say, okay, let's investigate this individual for a chronic inflammatory disease process. Now, how do we go about that? There's a few different ways. Of course, you want to acknowledge the patient's symptoms. You can use lab testing. And for our viewers listening, one of the values that I recommend discussing with your physician about obtaining is something called C-reactive protein, or CRP. This is a protein that's pretty easily tested in the blood work. It's pretty easy to identify, and it's non-specific. So when we see high levels of C-reactive protein, we just know inflammation is happening somewhere in the body, whether it's in the joints and that rheumatoid arthritis patient, or it's in the heart and that cardiovascular disease patient. This is a clue that we've become inflamed. When we're in our offices, we really like to look at other aspects of the blood work too. Where are the person's blood sugar levels, their glucose levels? Are they high? Are they elevated above 100 on a consistent basis? Triglycerides are another one. These are little fatty molecules in the blood that are stored in the presence of excess sugar. And fat, as we know, is very inflammatory. So we see high glucose. We see elevated triglycerides. We see an elevated C-reactive protein. Maybe we see some type of immune system reaction with the white blood cells in the blood work, right? We know that each of these things, when we combine them in the blood work, another great one while I'm talking about it is homocysteine. That's a great marker for cardiac inflammation. When we see the patient with these values and they're telling us that they're coming in with these symptoms, we're starting to be very suspicious that they're hitting that point of chronic inflammatory disease. And I just want to throw some numbers out there on it while we're on the topic of chronic inflammatory disease, just to discuss the magnitude of this, if you don't mind. So chronic inflammatory disease is this low-level inflammation that can affect the heart, the brain, the eyes. It is the most significant cause of death in the world, according to the World Health Organization, okay? They also stated it was the greatest threat to human life. Now listen to this. This was in 2014. 60% of Americans had at least one chronic inflammatory disease. 42% had 3 or more. I'm sure we can all think of someone who has diabetes, cardiovascular disease, arthritis. It's not hard to think of this person. Worldwide, I think this is one of the most scary statistics because this conversation lacks day to day when we're talking about healthcare. 3 out of 5 people will eventually die because of a chronic inflammatory disease. Now, whether that's a stroke, a COPD, a cancer, obesity, diabetes, right? Diabetes, which I know we'll be talking about more a little bit later, I just want to throw out some numbers on that. In 2015, it was the 7th leading cause of death. 9.4% or more of the population is diagnosed. That's more than 30 million people a year. That's being diagnosed, not with the disease. That's being diagnosed on a yearly basis. 1 out of every 3 deaths is due to cardiovascular disease and cardiac inflammation in the arteries. So I think that puts a good idea of just the magnitude of this. And I like to use those statistics again because some people may not think CBD may or may not be for them. Well, we're all subject to this. Just as we age, we become more subject to this. So that's really a point that I like to make.
Well, those statistics are really quite alarming because it includes almost everybody, right? It's just, what are the levels of inflammation that you're suffering from? Because I think we can honestly say, and correct me if I'm wrong, that all of us are suffering from inflammation on some level. So whether that's heart disease or it's, I ate fried chicken last night and I'm inflamed and now I can't sleep the next day, or whatever the case may be, there are some levels of inflammation in our body. And to your point, inflammation is the root cause of most diseases, correct?
Absolutely. And that's what we're looking for, is the root cause. So just to say, when we look at, and this is pulled right from a medical journal, after the podcast, we'll attach it for you. So when we look at the risk factors, so who's at risk for developing this chronic inflammatory disease, just listen to these risk factors. So age, the aging process alone puts us at risk. Now, why is that? As we age, we're all going to succumb to something called sarcopenia. And this is a muscle wasting that occurs with aging. When our muscles waste, we accumulate more body fat, okay? Having accumulated body fat is a risk factor for chronic inflammatory diseases. When people think of fat, they just picture this glob. In our offices, we tell people fat, specifically something called white fat, is actually endocrine tissue. Those chemicals that were released in an inflammatory process are actually released from excessive fat within the body called white fat. So age, excessive body fat, some other ones. A poor diet, this is probably one of the biggest problems we face here in the US. Foods are extremely inflammatory. You wouldn't believe the amazing results we see when we use some supplementation and proper diet in both the way a patient feels and their blood work. Lack of sleep due to stress these days, who's really getting 8 hours of sleep anymore, even 7 hours. And then stress would be the other thing that we're focusing on. Now, kind of an obscure one that leads to chronic inflammation is lowered hormone levels. Again, as we age, males and females are both going to go through this process where we're going to miss out on human growth hormone, where we're going to miss out on testosterone. And it gets worse, right? Because if we're not sleeping, our body's not producing these hormones in the proper amounts. So again, if you look at those risk factors, who isn't subject to this?
So what I'm hearing you say is that, once again, we're all going to suffer from inflammation. It depends on what level, because you could just be aging, but be at a healthy weight and eating right. So your inflammation would be less. It would just be age related. But then you can multiply the inflammation when you add a disease that you're struggling with, you have a poor diet, you're overweight, and you're getting old, right?
Yes,
So it's like
yes.
all of these things, much like many things that happen when we age, it's part of life, but there's things that we can do, which is really encouraging. Something else I read, Dr. Frank, is the signs of swelling. So maybe we can't sleep. I would have never before this conversation associated inflammatory diseases and inflammatory markers as a reason maybe someone doesn't sleep. But then maybe there's some more obvious signs like redness and stiffness, right? Is there anything else? I mean, there's the obvious and the not so obvious signs of inflammation, correct?
Yes, of course. Yes. So the more obvious ones that we certainly deal with on a day-to-day basis that are obvious would be that patient who comes in with the knee pain, the patient who comes in with pain. Where's a really common area? We use CBD oil, actually on arthritic joints right here in the thumb. This is a common area where people will need joint replacements or cortisone injections. So those are the obvious ones. The joint is hot, it's a little bit inflamed, maybe we just injured it, maybe it's very cold out, or there was a dramatic change in temperature and we start to feel that joint pain, right? So I'm glad you brought this up, because this is really an area where I feel the topical CBD cream, we use the 500 milligram strength in our offices, can shine. And we kind of touched on this last week. So when you have that initial injury, that initial splinter, that initial jamming of your thumb or your toe, I tell people, wait a day or two before you put the CBD cream on. Just let that initial inflammatory reaction occur, then use the cream. Because what happens is your skin has the largest amount of CB2 receptors on it. Cannabinoid number 2 receptors are widely found on your skin. When you apply the topical CBD cream, it's going to bind to those receptors and decrease that localized inflammation, that obvious inflammation, right? So when we talk about knee pain, pain here in the thumb, golfer's elbow, tennis elbow, and inflammation of those tendons, this is where we really see the cream having a really positive impact for a lot of patients. Now, as a disclaimer, of course, you have the occasional where it may not work, but most of the time we're seeing a really, really positive impact with our patients.
I have another physician that we work with, Dr. Frank, that says oftentimes the physician knows if somebody says it didn't work, then they know that it's not stemming from inflammation. There may be inflammation as a result, but if they say, it's not helping me to the point that I thought it would, then doesn't that clue you in as a physician that maybe there's something else going on?
That is such a great point. And I'm really glad you brought that up because that's undervalued. I tell patients I say to them, listen, I'm suspicious that you have knee arthritis and I really expect this to work because in my experience, 95+% of the time, people are getting some degree of pain relief. Maybe not complete, but there's some degree of relief in there. When they're not, that's when I'm starting to say, wait a minute, maybe we need some blood work on this. Maybe we really should consider ordering an x-ray or an MRI. Maybe this is a little more complicated. Maybe that meniscus is fully torn, or maybe there's an autoimmune disease in there, like a rheumatoid arthritis or ankylosing spondylitis, something that's not going to respond to just a topical application. So that's a fantastic point, and I really couldn't agree more with that position. It's almost weird when it doesn't work. It makes you step back and say, wait a minute, maybe there's something else here.
Yeah. So if somebody is listening to this and thinking they have inflammation and they want to try the topical pain bombs or the oil that you would take sublingually or orally, and you're not getting the results, don't give up. Maybe that's when you want to go see a holistic practitioner, someone similar to Dr. Frank, and even ask your primary, but understand that there might be something else. So those are some questions to know, to ask. And because we see such amazing results with CBD. So let's talk about how CBD then can help with inflammatory issues, whether it's acute or chronic.
So the acute one, really, I would say the cream is our go-to for that stub toe, that injured knee. The CBD oil binds to those CB2 receptors on the skin, and it actually fights inflammation. We're treating the root cause, remember. We're not just covering up the pain. We're actually having an impact on inflammation, right? So that's really that for the cream. And I say this every time, and I'll continue to. I think the emu oil in your guys' cream is really something special when it comes to longer lasting pain relief, when it comes to seeming to hold that inflammation at bay for a longer duration of time when compared to other products that we've used prior to working with you guys. So for that acute inflammation, we love the cream. Now for that more chronic inflammatory disease, when we're using that, Stacey, I'm sorry, go back to the question about the chronic stuff. I forgot where I was going with that one. Yeah.
What you recommend in terms of dealing with and treating chronic inflammation?
Yeah, so that's usually where we're looking to the oral oil. And in our offices, we usually start with the 1,000 milligram. That's usually where we begin. And like anything, we're looking at, when we're talking about chronic inflammatory diseases, and we'll be discussing diabetes in a little bit, we're usually in that what's called that standard dose range of 10 milligrams to 100 milligrams a day. Now, that depends on the individual. If someone's in really rough shape, absolutely, we may be going up much higher using a 3,500 milligram concentration. But for your average person with a moderate amount of inflammation, so maybe they have some cholesterol issues, maybe there's pre-diabetes and some knee arthritis, they're trying to get help with the pain, they're trying to hopefully see if it will help benefit their blood sugar levels. That's really where we're prescribing the oral dosage. And the reason for that is because CBD oil in your internal endocannabinoid system help to regulate your body's immune system. And what is inflammation? Inflammation is really your immune system reacting to something, right? Some type of irritant, some type of chemical, some type of poor food. And what we know about CBD oil is it helps to balance the immune system. CBD oil, it turns down the volume on all those chemicals that we were talking about earlier when taken orally, on all those inflammatory chemicals. So again, if you could imagine all those blood vessels dilated and all these inflammatory things just rushing all over the body, CBD oil, when taken orally, it appears that it helps to turn down the volume on those chemicals. And that's huge for someone who's chronically inflamed. Now, the other reason I believe, and I think we're going to see a lot of literature on this, we know, as we discussed in previous podcasts, that The CBD oil helps with sleep, right? CBD oil, we know it can help with depression. We know it can help support healthy levels of stress, right? So for that anxiety patient. Earlier, we talked about what causes inflammation, what predisposes us to it. Poor sleep, right? Depression, too much stress in life, a poor diet, all these free radicals floating around from junk. We know that CBD oil helps combat that. And one of the things that I think goes understated, and I'm actually just going to quote the patent from the government patent that they have on the CBD, right? Because this is really great. I think this is an easy thing to quote. It gets around the situation of us having to say, hey, listen, this may help with, this may not help with. When it comes to inflammation, most of the damage is coming from things called free radicals, right? Imagine these are little dangerous chemicals and compounds floating around in the body causing destruction. How do you beat free radicals? You take antioxidants. This is why they tell you to take a vitamin C to boost your immune system. Antioxidants prevent, we call it intercellular rusting. So you know how a car will rust if it's damaged, or a banana turns a different color if you leave it out? That's rusting. This happens in our body because of inflammation. And the best way to prevent that is with antioxidants. Well, according to the government patent, and I'll read this right off of here, cannabinoids have been found to have antioxidant properties. They have a prophylaxis for a wide variety of oxidation-associated diseases. Oxidation is another word for inflammation, such as ischemias, age-related inflammatory and autoimmune diseases, things resulting from ischemic insults, so lack of oxygen, stroke, trauma, concussions, neurodegenerative diseases, Alzheimer's, Parkinson's. They also mention non-psychoactive cannabinoids, CBD, are particularly advantageous because they avoid toxicity. Now, they also, in the end of this, refer to it as a neuroprotective antioxidant. What's a neuroprotective? This is something that protects your brain and your spinal cord and your nerves. That's what makes up your nervous system. And they're saying this is a strong antioxidant. CBD is an antioxidant when it comes to protecting your nervous system. What damages our nervous system? Low-level inflammation. So when I talk to patients about this, you don't want to make claims about this, right? You really do have to be careful, especially now it's gotten a lot of attention from the FDA. Not everyone follows these guidelines. I tell people, provide them with this patent, show them this patent from the government. You don't have to make a claim. You can read it right off here. If this person has one of these chronic diseases, we know they're suffering from chronic inflammatory inflammation. Read to them this patent. It talks about CBD and how it benefits.
It's really amazing, and I love that we have that USA patent because it does kind of put that stamp of approval. There's a lot more testing that can be done, but this product that we offer is a full spectrum product, so you get all those cannabinoids minus the THC, because we don't want people getting high if we don't really need the THC in order to get the medicinal benefits from what we found. So it really is fantastic that we can take a natural product that can help fight that chronic inflammation, even that acute inflammation that people are all suffering from. We hear all the time, because CBD is such a balancer, we hear people say, well, this is the disease that I'm dealing with and my numbers are better, depending on what the disease is. And all the time people are saying, wow, I was taking this for sleep, but lo and behold, my XYZ has improved based on my blood test. And I don't want to be specific. I don't want to name some of these things, but you will notice I encourage people that are watching to get their blood tested now, right? While they're watching this, and then take CBD for a while. And Dr. Frank, maybe you can speak to what that time frame would be, and then have your blood tested again and see what the improvements are.
Absolutely. And to your point too, so usually when we run blood tests, we go a while in our offices. We go a period of, I would say, about 18 weeks. If something isn't really making sense, we might test it sooner to see what's going on. But generally speaking, I think the shortest duration of time is about 18 weeks, at least three months at a minimum, I would usually recommend. Now, when we work with people too, and this kind of goes to your point, if you're just starting taking the CBD, get your blood work, understand the results of it, And this now might be a perfect time to make some other healthy changes in your life, right? So we're seeing tons of literature coming out on CBD for helping people to quit smoking with nicotine withdrawal, opioid withdrawal, right? So we work with our patients and we try and educate them and tell them now is the perfect time to start that anti-inflammatory diet that you've been thinking about. Now is the perfect time to start exercising. And we describe it as CBD is going to be that little extra boost that ideally helps them do that successfully. So whenever I see someone who's just starting CBD, I want to know, look, what are you dealing with? Because let's just attack this all at once. We got this powerful, cannabinoid that we're going to give you, and we're really expecting it to go well. But if you can further support how well CBD oil works, why wouldn't you? Why wouldn't you start eating healthier now? Why wouldn't you try quitting smoking if that's something you're battling? And I think those patients see even better results than the patients that don't make those extra changes. And we know CBD oil, its effectiveness is to an extent related to the lifestyle of that individual. And whether we're talking about CBD oil or medication, if I'm taking CBD oil for sleep, but I'm, having 2 or 3 cigarettes with a cup of coffee at night and a drink for dessert, you're spinning your wheels, right? How far ahead do you really expect to get? So we absolutely.
So briefly, if you could speak to what people, so we have different ranges of people that will be watching, right? People dealing with an acute inflammation or chronic inflammation. So what would you recommend for people that just who are watching and saying, well, I don't smoke, I don't drink, I eat right, I'm exercising. What would be a daily serving size that you would recommend for just maintenance and helping to maintain a healthy balance?
Yeah, of course. So I think it really varies. And I'm excited because they're trying to figure out more literature on these maintenance doses. What we're seeing, how do you take it prophylactically, right? To prevent chronic inflammatory diseases down the line. So right now, and I'll say this is based on experience, this is based on patient results, but I can't say I have like hard medical literature on this yet, just because it's not there. But generally speaking, we're probably somewhere between 10 and 40 milligrams a day, which is pretty low. That's not asking a lot of someone. Now, depending on the person and what we're trying to accomplish for maintenance, it could be higher. But for your average person who's pretty healthy, no major issues, really no complaints, they're not on any medications for anything, we're probably between 10 and 40 a day. Myself, I usually use about 10 milligrams a day. It would be pretty standard for me. And that's a great point. I used to take more, but I decreased it over time. That's a lot of people find that's what they do. But
Absolutely.
10 to 40 milligrams is our advice. Now, again, I certainly have patients who are taking a much higher maintenance dose, but I find that's a safe number. And like anything, I tell people if it's their first time trying to find that maintenance dose, start slow. Maybe you start with 5 milligrams, then maybe 10, then 20, then 30, then 40. I say just start slow because I do have some patients who take just a few drops, 4 or 5 drops underneath their tongue a day, and that does the trick for them. So start slow. You can always add more.
Okay, great. Well, we know there's a lot of diseases that are caused from inflammation, and we'll end this segment on inflammation. Of course, you can go to our website at cbdbiocare.com. We have information about serving sizes. It talks about micro dosing, macro dosing, and then standard dosing. I'm calling them dosing, but it's because I was listening to Dr. Frank. It's actually a serving size because I'm not a physician. But we are also going to be discussing diabetes. So, that is another segment that you can look for on our website. Thank you, Dr. Frank.
Stay tuned anytime. Bye, Stacey.